Okay, so thanks everybody for joining us this evening. I am Miranda Hess from Lehigh County Intellectual Disabilities, and I have with me my counterpart, Emily. I'll let her introduce herself.
Hi, everyone. I'm Emily. I'm a program specialist for Northampton County Developmental Programs.
And we're glad that everybody decided to join us tonight. We're going to talk about initial eligibility to county services. And we are also going to talk a little bit about waiver eligibility as well. So like I said, if you have questions, feel free to stop us if you don't understand something we're talking about. But we are going to jump right in. I'm going to share my screen. All right. Can everybody see that? All right, wonderful. Okay. Hold on. Sorry, I'm like struggling with this PowerPoint. Okay. All right, so just to get a little bit background information, some people might be very, very new to some of these presentations and to what the county program even is. So first we like to talk about what does the system look like in Pennsylvania. So in PA, the intellectual, I am so sorry, guys. I'm like not tech savvy.
I can share my screen, Miranda, if that would be easier.
If you want to do that, that would be awesome. I'll stop the share.
Okay. It's loading, so
Okay, I made you a co-host also. I don't know if we need to
sweet.
do that, but
Okay. And I'm going to share my screen.
thanks.
Okay, we're good.
All right, so like I was saying before, the system, the intellectual and developmental disability system in Pennsylvania, is part of the Office of Developmental Programs, and that's within the Pennsylvania Department of Human Services. So in order to access the intellectual disability and autism system, everybody needs to go through a county or joiner office, which is also called an administrative entity or an AE that is partnered with an ODP regional office. So a lot of counties are just one county. There are some joiners, which is a couple of different counties that join together. So for example, Lehigh and Northampton, we each have our own separate county office. Carbon Monroe Pike, if you're in that area, they have a joiner with the 3 counties. So currently there's 4 regional offices within the state, and they partner with 48 administrative entity offices.
So here we have the structure of how, the system looks for everyone. So I guess you have your state entity, ODP, which is the Office of Developmental Programs and Bureau of Supports for Special Populations. It is the state or, part of the Department of Human Services. And then below that, you have your AEs, your Northampton counties, your Lehigh counties, who are agents of the state. So as Miranda mentioned before, Northampton County, is a sole AE, and so is Lehigh, but then you have your jointers like CMP. And then the AEs get families connected to what is known as your SCO, or your Supports Coordination Organization. So those are your SAMINCs, your Quality Progressions, a Bridge to Independence, CareLink, and they're essentially going to be that case management aspect of ODP, and they'll provide you with a SC or a caseworker. Oh, you're muted, Miranda.
Thanks.
Yeah.
This just talks a little bit about the role of the administrative entity. The AE is a county or joiner that has a contract with the state to oversee the consolidated community living and person family directed support, or PFDS waivers. The term administrative entity may be used in place of the word county when discussing IDA services. So sometimes you will hear people refer to it as a county. Sometimes you'll hear people refer to it as an AE or as an administrative entity, and they're really interchangeable terms.
So just here is like a little bit of some of the roles at the AE that we take care of. We all follow the same guidelines, but each office might, just have different structures on how they operate and do things. But overall, we do follow the same guidelines. So one of the main roles that we'd have here at the county or AE would be to determine eligibility, approve and authorize services for individuals like on the ISP, qualify and monitor IDA service providers, develop and implement quality management plans, assign waiver slots based on needs. That's going to be like where your PUNS list comes into play. And that's just like the wait list for funding. And then collaborate with the SCOs to ensure that needs are met. So, like I mentioned before, each county can do things a little bit differently, but I know between Northampton and Lehigh, we do meet with, the SCOs frequently just to kind of discuss what's going on, who's in need. The SCOs are able to provide, a list of their priorities of, who's needing what, who's in the most need, and bring that to our attention so that if a waiver becomes available or is available, the AEs can discuss, waiver assignment.
Oh, I got the easiest slide. So this just talks a little bit about the role of the supports coordinator, and I'll do the next one too. I was just kidding, Emily. So the supports coordinator really has three main roles, and that's locating, coordinating, and monitoring supports for the individual. So I knew this was coming up. So the first part, locating. So examples of locating services and supports would include things like developing the individual support plan, which is the plan that we really use to drive all of the services and supports that an individual receives. It would include assessing their needs, helping an individual find ways to meet their needs, whether that's through funding through the administrative entity office, or whether that's services or supports through other mechanisms, providing families with information about existing resources. So sometimes there's things that people are already eligible for that they don't even realize, whether that's through their insurance or through other community programs, and identifying willing and qualified providers once an individual is enrolled in waiver services.
Another role that an SC has is going to be coordinating. So just making sure that the ISP is properly managed, developed. So I know in other presentations that we've done before, we've talked about how to read an ISP, and part of that had to do with, how often it has to be reviewed. So the ARU is an annual review update. So SCs are responsible for reviewing that on an annual basis and obviously updating it throughout the year. Coordinating with entities, resources, programs, and individuals' natural supports. So what that looks like is, let's say you are looking for services and you don't really know what the providers, who the providers are and what services they offer. So your supports coordinator is going to be that person that's going to establish contact with your provider and make the referral in order to get services started. Another role would be to provide families with information about the IDA system. So, supports coordinators are there to kind of be like a resource or a library of knowledge for families, depending on what they're looking for, because families don't know what they don't know. The system is very complex. So making sure that families are able to navigate that depending on their loved one's needs. And also an SC can be placing an individual on wait list for funding if needed, like that PUNS list that I mentioned before.
And then lastly, monitoring is a role of the supports coordinator. So we're talking about monitoring an individual's health and safety as well as monitoring their services. So they will ensure that an individual's health and safety needs are met. They will check on their waiver services. Are they being delivered appropriately? Are all of the individual's needs being met? Are there additional service needs? The progress that the individual is making on their outcomes, if they are satisfied with the services that they're receiving, both in terms of the frequency and duration of the services, as well as the service providers and the staff and those sorts of things. And just kind of general advocacy for the individual within the IDA system. So, making sure that the administrative entity is aware if the individual needs an increased level of funding, or if they have other service needs that aren't being met.
So why you should register for, IDA services. So in order for the state to plan and fund services, for individuals, the county, the state, whichever entity, they need to know that you exist and that you need some type of support. Um, a lot of times, these systems, you don't go about hearing about them very often until, someone mentions it, like, oh, are you set up with a caseworker? And that may not be until, if you have a child who's in school and they're about to graduate, things like that. So one thing is that when you initially come through the system, it's going to be for supports coordination only. It does not guarantee funding right upon eligibility. However, if you want to receive funding in the future, you can't receive supports coordination or the funding for services or be placed on wait lists without being open in our systems. So in order to get those waivers, you have to have a support coordinator in order to seek out these providers and these services, and to use funding, if identified, you have to be open with us through our offices.
So the puns, people might have heard about the puns. You might be wondering what exactly is the puns. So puns is an acronym. It stands for the prioritization of urgency of need for services. And this essentially is the waiting list that a county uses in order to prioritize funding and waivers for individuals. The puns form gathers information about the individual's current situation, their needs, both current and anticipated needs, and what services and supports may be needed through ODP. The information is used by the state to plan for future budgetary needs, and counties use it really just to kind of prioritize when there is waiver availability, who has the greatest need and, has been waiting for a long time, those sorts of things. The PUNS form describes how soon services and supports will be needed in 3 different categories. The emergency category means that supports are needed immediately, and the state defines immediately as within the next 6 months. Critical means that supports are needed in more than 6 months, but less than 2 years. And planning means that supports are needed in more than 2 years, but less than 5 years from now. So really, it's kind of a budgetary tool. The state will pull data across all of the counties to see, how many people are going to be needing supports in the next 5 years and that sort of thing. A lot of times we'll get calls and people will ask us things like, well, where am I on the waiting list? Or a lot of times, when we get new referrals, people will ask, well, how long is the waiting list? So the PUNS is not like a typical waiting list. It's not like you start at the bottom and you work your way up to the top. It's ever changing. So it really depends on how an individual's need compares to every other individual's need on the PUNS at that moment. So you really can't gauge how soon, somebody will be able to be moved off the PUNS list. It really depends on their needs compared to everybody else's needs in the county that they're registered to. So we have some PUNS numbers on here just so that people have an idea of how many people are on the PUNS. I think I updated the Lehigh County numbers a couple of weeks ago. I'm not sure about Northampton County numbers, how up to date they are. But this just gives you an idea of how many people are in each category on each of the county's waiting lists. So there is, a significant amount of people that are on the waiting list. A lot of times people get really nervous when they start seeing those numbers, but I always like to tell people that, if there's really a true emergency that somebody needs services right away, no county is going to let that person be in a unsafe situation. So counties are always going to make sure that something is available to ensure that an individual's health and safety needs are met. It might not be a perfect situation. It might not be the situation that maybe the individual or family is looking for, but a county is not going to allow somebody's health and safety needs to go unmet. So please don't panic. I know a lot of times people worry about, well, what if something happens? What if there's like a true emergency and the caregivers are incapacitated or something like that? Please do not be nervous about situations like that. We'll make it happen.
So linking up with, the Office of Developmental Programs, each county here has their own intake phone number. and just kind of a little bit what that process is going to look like. So basic demographic information and a request referral must be made for developmental programs. Your information is then passed down to a county intake worker. And there's going to be additional information that's going to be required because we are eligibility based. So that's something to note, that just because an individual may have an intellectual disability or autism, it does not automatically mean that they will be eligible. I know that's one of the things I primarily focus on at Northampton County is, determining that eligibility. But basically we have to wait until all the information is requested or all the information requested is delivered so that a determination can be made. And here at the counties, like, we're here to help. We're able to kind of provide some guidance as to what documentation is needed. Just because these guidelines are established by the state, and they've definitely gotten a little bit more complex over the recent years, just determining how a person is eligible. So what kind of tests we accept, things like that. But here at the county, we'll be able to kind of guide you as to where to find this information. If a person is deemed eligible, you as a referral will be notified, and then you get to choose your supports coordination organization from which to receive services. So as we mentioned before, there are a couple agencies to choose from, and you'll get to select which one is going to provide you with a supports coordinator. Once you are enrolled with supports coordination, that caseworker is going to be in touch with you in order to schedule their intake meeting. Because even though you come through the eligibility intake process at the county, the supports coordination organization has to complete their own intake meeting in order to develop the ISP for the individual.
So unlike public education, which is an entitlement, intellectual disability and autism services are eligibility based. So this does mean that some people are determined to not meet eligibility criteria. That might seem kind of obvious, but we always like to say it because just because somebody has a diagnosis of autism, or even because somebody has a certain IQ score, they're not automatically eligible. There are other eligibility requirements that go along with those diagnoses. Eligibility determination can be a lengthy process. Sometimes we have challenges gathering all the documentation that we need in order to determine eligibility. Sometimes we might need to send the individual for some additional assessments to be completed. So it sometimes can take a couple weeks or sometimes even a couple months to get the eligibility determination process completed. So we just like to tell people that and recommend that if you are not already linked up with your county, to call and make a referral right away, so that the individual can become registered with their county before a need arises. And then that individual can receive assistance more quickly if there is a need. So don't delay, make a referral. I think that there's phone numbers somewhere in this presentation of who to call to make those referrals if you're not already registered.
So eligibility categories. So before, a couple years ago, the only diagnosis that we would support was intellectual disability. However, over the recent years, that has expanded. So a person can come into our system, if they have a qualifying, intellectual disability, they can come in under as autism spectrum disorder without the ID diagnosis. We have another category for developmental disability for children 8 or younger, and then also children or young adults of 21 or younger with a medically complex condition. So those are 4 different categories that you can come in order to make a referral for to receive an SC.
So eligibility documentation required. This is in addition to the disability verification. We ask for a copy of the individual's birth certificate, social security card, medical assistance card, guardianship paperwork if applicable, and the individual has to have an address in the county. So, I mean, obviously, if you're registering with Lehigh County, the individual has to be a permanent resident of Lehigh County, and the same thing for Northampton County. If you're trying to register with Northampton County, the individual has to be a permanent resident of Northampton County.
So intellectual disability diagnosis. So typically an IQ or a person with an ID is determined to have it because they have an IQ score that is 2 standard deviations below the mean. So what that means is, there's typically average is considered 100, a standard deviation is considered 15. So a person would have to be 2 standard deviations below 100. So that would be 30 points. So a person with an IQ score of 70 or below typically results in an intellectual disability. However, there has to be a report included that's stating that the results are valid. So what that means specifically is a person might score low, but there could be other factors associated with that score. If a person is going through trauma, if a person's having other responses or other diagnoses that affect their scoring, we have to make sure that the results are valid. And the report also must be signed by a qualified professional. So that could be a psychologist, a developmental pediatrician, things like that. So I know in the past, licensed social workers have diagnosed individuals with autism. However, they are not considered a qualified medical professional to determine the diagnosis. So that's one part of the clinical information that we need. And then another assessment that we would need to review is basically the results of a standardized assessment of adaptive functioning. There have been other assessments in the past, such as the BASC or the CIBAR. However, the state right now only allows us to review either the ABAS or the Vineland. And similarly to, the ID, kind of threshold of the 2 standard deviations, for the most part, we're going to be looking at that same kind of threshold for the adaptive scores as well within the ABAS or the Vineland. Also, one thing to note is that we do support life through death. There's no, unless they're coming under the developmental delay diagnosis and that medical complexity, but because we're talking about ID specifically, there has to be documentation that the disability was present prior to the age of 22. And given that might sound a little strange, because if a person has an intellectual disability, they're going to have it for life. However, there's information out there that a person could have a traumatic brain injury and that results in like cognitive deficits. So we have to make sure that the ID diagnosis was present prior to the age of 22.
Oh, this one's really small. So for autism eligibility, so we have some really specific requirements in terms of what needs to be included in the report that we receive. So first of all, it does have to be an actual report. So we will sometimes receive letters that a doctor has written that says, this person has an autism diagnosis and is under my care. That's a good place to start, but is not something that we can use for eligibility determination. We do have to have an actual report that was completed by a licensed psychologist, certified school psychologist, psychiatrist, developmental pediatrician, licensed physician assistant, or licensed nurse practitioner that certifies that the individual has a diagnosis of autism spectrum disorder. And this is the really important part, guys, as documented in a diagnostic tool. So there's no specific diagnostic tool that's required. The state recognizes that there's not one, standard tool that is, universally used for autism diagnosis, that there's a lot of different tools. Some of them are much more formal than others, and some of them are incredibly informal. So any of the tools that are listed are acceptable. There's a number of examples of formal tools like a GARS or an ADOS, but it could even be informal tools such as clinical interview and observation. But it basically has to spell out that the person has an autism diagnosis, but also why the clinician believes that that is an appropriate diagnosis for the individual, rather than some other diagnosis. So it can't just say autism, it has to also include kind of the why of it.
I guess also to continue, I guess backtracking a little bit, I guess the reason why we also use informal tools is that we also see, older individuals, adults who may not have had this form or diagnostic scale for autism. So that's why we have to be mindful that we can use informal assessments. However, they have to be supported with evidence as to why this person is believed to have autism. So I just wanted to mention that as well. Like the intellectual disability or eligibility aspect, we also still have to review the adaptive assessments such as the ABAS or the Vineland. We also have to see, that the diagnosis was present prior to the age of 22. The report must be signed by the evaluator, again, those qualified professionals. In order to come into our system, the individual must have active medical assistance. If a person let their MA lapse for whatever reason and they're coming in through intake and we go to verify that, we cannot deem them eligible. Once a person, comes in and, we have all that clinical information, there's going to be a couple more forms that need to be filled out under the non-ID program diagnoses. So the MA51 is also known as the medical evaluation. It basically looks like a physical form. It looks a little bit more confusing than what it is. It's very basic where it has demographic information. It includes the individual's diagnoses, their diagnostic codes, any type of therapies that they may be receiving. However, there's a specific question on that form, which is actually question 20A, which is the physician's recommendations. And for anyone coming under a non-ID diagnosis such as autism, they would have to have that ICF or ORC level of care box selected. So I know, like, when I'm sending out those forms, I make sure I highlight it because sometimes that box is the one that gets people held up, before enrollment for that. And then also, in addition to that MA51, we will also need to see the DP 457, which is another form, which is a service preference form, or in simpler terms, like the waiver application form, just highlighting that you are looking to seek out supports through home and community-based waiver services.
So for developmental disability eligibility, this is specifically for kids who are aged 8 or younger. And again, it lists that whole big list of different practitioners that can make the diagnosis. But essentially, what we're looking for is that the individual has a developmental disability with a high probability of resulting in an intellectual disability or autism. So what we're really looking for is a child who is age 8 or younger who probably will end up with a diagnosis of intellectual disability or autism, but maybe they're just kind of too young to have that diagnosis yet. So the evaluator gave them the developmental disability diagnosis. If you want to go to the next slide, Emily, I'll keep talking about this one. Basically the evaluator gave them the developmental disability diagnosis, but they have to be age 8 or younger. And then once they turn 9, we would have to flip them either to intellectual disability eligibility or autism eligibility. If when they turn 9, if they do not meet the criteria for one of those two eligibilities, then we'll get to the next one later. If they do not meet one of our other criteria for eligibility, we would have to then close them at that time. I don't know about you guys, Emily, but I think that we open maybe 2 or 3 kiddos under this developmental disability eligibility. And none of them are even 9 yet. So we've not yet reached that stage. But in addition to the developmental disability, again, the individual would have to have the substantial limitations in major life activities as documented on the ABOS or the Vineland. We do need to have a report that indicates the developmental disability, which must be signed by the evaluator. They must have active medical assistance. Again, that MA51 form needs to indicate ICF ORC level of care in section 20A, and the individual's parent or guardian would need to indicate home and community-based service preference on that DP 457 form that Emily talked about under the autism eligibility.
And I guess one of our newer categories is medically complex individuals. So this one is a little bit different. I don't know how many people you have at Lehigh, Miranda, but we have one person under this category. It's it's very interesting to see because it's a little bit different in terms of like some of the documentation up front, specifically with the form that's the DP 1090. So that's a form that would need, so all of the documentation that we've seen before for the other categories, we would need to see, you know, for medically complex as well. However, there's going to be an additional form specifically, the DP 1090, which needs to be filled out by a doctor. And it has to highlight that the person requires a skilled nursing level of care, and that the individual also has chronic health conditions that affects 3 or more organ systems. So what that looks like, you know, interventions for respiration, nutrition, medication administration, or other bodily functions. So again, that's a form that is provided, and, you know, we would provide that during intake, has to be filled out in order for us to determine eligibility. This category is supported until the age of, through the age of 21. So the individual has to be below 22 in order to come in under that category. I can keep, you know, going with this one, but, you know, similarly to the previous categories, we would need to see the deficits in the ABAS or the Vineland. I don't think we touched about how many deficits, but for the most part, it's 3, except intellectual disability. You can only have 2 to come in, but then that gets weird when you're talking about waiver eligibility. So yeah. Again, similar requirements where the report has to be signed by an evaluator. The individual must have active medical assistance. The MA51 also still needs to be completed and have that ICF-ORC selection made. The DP 1090 is going to be that different addition from all the other categories, because we have to ensure and review that the chronic health conditions affect 3 or more organ systems and that there's a need for skilled nursing. And then also we would also need that DP 457 form, as we've talked about before.
So once we determine eligibility, people always ask, so what will I actually be eligible for? So the first thing that everybody is eligible for right off the bat, once we determine eligibility, is supports coordination. So this would be that caseworker. The supports coordinator is required by regulation to have contact with an individual a minimum of twice a year. So they're required to do an annual individual support plan meeting to review the individual support plan each year, and then they are required to do 1 other face-to-face monitoring per year. So a lot of times people are really surprised because they call us and they say, I've not heard from my supports coordinator in 4 months. And that is pretty typical when somebody is first opened and all they're receiving is supports coordination. What I can tell you is that if you have any needs that aren't being met, or, you know, if you have questions, you can certainly call your supports coordinator anytime in between. You do not have to wait for your supports coordinator to reach out to you, but don't be surprised if you only hear from them about every 6 months or so. Once you're determined eligible, you are also eligible to be placed on the PUNS list. So you can get put on the waiting list for waiver services if you have a waiver service need. And depending on the eligibility category and the county of registration, an individual may be eligible for FSS or other base funding. Rules and availability for this funding vary from county to county. So if you have questions about FSS or other base funding, reach out to your administrative entity or county of registration and ask them if your loved one or yourself might be eligible for FSS or base funding.
So funding, we're going to touch base on that now. ODP is always going to be the payer of last resort. So what that means specifically is a individual has to pursue all other funding options before an ODP waiver can be identified for a person. A prime example is going to be, you know, if an individual, let's say, needs skilled nursing will be needed, you know, will be funded through the insurance typically until the age of 21, especially if a person has Medicaid or their medical assistance. And then once they turn that age 21, the insurance kind of drops off and they're like, well, now who's going to pay? That will be the time that an ODP waiver would kick in order to continue funding that skilled nursing. So that's kind of, you know, one of the most extreme or, you know, examples that we see. So that's something to consider. base is administered by each county. So that's going to be those FSS funds that Miranda talked about in the previous slide. So those are just, like a small allocation of county funds that can be used for, specific things. And then you have your waivers. Those are your combination of state and federal dollars that would fund services for an individual. So there are 3 different types of waivers. So the first type of waiver is the PFDS waiver. That has a cap of $41,000 in services per fiscal year. However, that cap can be exceeded by $15,000 a year, as long as the individual is receiving some form of competitive employment support, such as like a job coach. However, all other services have to remain below that $41,000 cap. PFDS is because they have that smaller cap, that smaller budget. It's not going to support a residential placement. So that's something to be mindful of. Your next type of waiver is going to be your community living waiver. That is up to $85,000 a year in waiver services. Typically there are no cap exceptions when it comes to a CLW, kind of like you have your $85,000 per year, you have to remain below that cap. And then the last type of waiver is the consolidated waiver, which has no cap. However, it's very specific in terms that like all the services that are in place have to meet the individual's needs. You wouldn't just be able to add services for the sake of adding them. They have to be, justified as to what the individual needs. So those are your 3 types of waivers that are provided through the state. And again, ODP is the payer of last resort. One thing to note too is that let's say you start off with a PFDS waiver, and as your family loved one, or whoever you're supporting, let's say that PFDS is no longer meeting their needs. Let's say they need additional services. In that situation, your supports coordinator would place you yet again on the wait list, on that PUNS list, so that you can be moved around or, considered for a higher level of a higher waiver. So that's something, just because you get one waiver, it doesn't necessarily mean you're stuck there for life. It just depends on the needs and whatnot. So it's going to be important to keep in contact with your supports coordinator and let them know of any changing needs, even if you have a waiver.
So we did have a question in the chat about what age can an individual get waiver services, and I'm going to talk about this slide, and then we're going to talk about that question, because I think there's not really a black and white answer to that question. So, but here's what we will tell you. So waivers, the payer of last resort. Since ODP services are the payer of last resort, waivers cannot fund services that an individual is eligible to receive through another source, including public education. This would also include the Medicaid state plan for individuals who are receiving Medicaid. So Medicaid services for children go up until the age of 21. There's a lot of services available through Medicaid for children, such as skilled nursing services, behavior support services, those types of things. So waiver can't pay for any services that are eligible through another payer. That means that if students are eligible to remain in school until the age of 22, there are certain services that can't be paid for through waiver prior to the age of 22. So if you have a supports coordinator and your supports coordinator is telling you, hey, with this new 22 graduation rule, your individual really needs to stay in school until they're 22. And this is why, because while we could enroll somebody in a waiver, there's a lot of services that we really can't authorize because they're still eligible through a different funding mechanism. On top of that, waiver enrollment is prioritized for individuals who are graduating high school at age 22. So what that means is we have specific waiver slots that are essentially earmarked for individuals who are graduating high school at age 22. So basically, if you stay in high school until your 22nd birthday, you're pretty much guaranteed to get a waiver. If you choose to leave high school prior to your 22nd birthday, you essentially are on the PUNS waiting list with everybody else that's on the PUNS waiting list. So we've showed PUNS numbers before. Lehigh County has about 300 people on that waiting list. So instead of, staying in school until you're 22 and having a 100% chance of getting a waiver when you graduate, as long as you meet all of the functional and financial eligibility criteria, you're going on that general waiting list with 300 other people if you choose to leave school prior to the age of 22. So, we would never tell a family that their child can't graduate school prior to 22, but please know that that's a real thing that happens. Obviously, if you have emergency needs that you need waiver services, we're not going to not enroll somebody because they graduated early. However, keep in mind that there are certain services that we would not be able to authorize for that individual until they are no longer eligible for those services through other means. So there's really specific requirements in terms of age requirements and other things like that. So we cannot authorize any skilled nursing services for somebody under age 21. We cannot authorize any behavior support services for someone under age 21, and just certain things like that. If there are services that the public school system would be be required to cover for a student up until the age of 22, we wouldn't be able to pay for those services until the individual turns 22 and is no longer eligible for them through public school. So we know that a lot of families are getting mixed messages from schools right now in terms of, yes, you can stay in school until you're 22, but you can leave earlier if you want. That's true, you can, but that doesn't mean that you're necessarily going to be eligible to get certain services paid for through the waiver. Okay, so we have a question. My son will be 22 on September 21st. Should he start the school year only to be there for 3 weeks? Will his waiver eligibility be affected if he graduates in June of 2024? So what I'm going to tell you is to reach out to your administrative entity. We're kind of discussing a lot of these things on a case-by-case basis. Number one, the 22 thing is still really, really new. So we don't necessarily have every protocol quite ironed out yet. And we understand that everybody's situation is a little bit different. So we want to make sure that everybody's needs are met and that we're doing things in a planful way that makes sense for people. So what I'm going to say for your situation is if it's a Lehigh County person, we agree. It does seem kind of silly that an individual would return to school for 3 weeks. So we would probably work with you as a family and supports coordinator to make sure that his needs are met in a way that makes sense. You're Northampton County. Okay, so talk to Emily then.
Yeah. Okay. No, so obviously that new guidance kind of definitely scared people because they're scared as to like where they would be on the waiver list and things like that. So ODP did state that our waiver protocols don't necessarily need to change, that we would still be looking at grad initiatives at the age of 21. Because everyone's going to turn 22 at a different time. That's something that we can't really predict or be able to monitor in like a chunk of time. If your loved one is turning 22 in September, we would probably review them with our 2024 grad initiative list. So as of right now, Northampton County, I think, has like 30 some individuals who are expected to graduate at 21 this coming June. So that's kind of like a list that we gather, throughout the year to see what those names are, so that, services can be coordinated. So I'll leave my email in the chat, and that way you can reach out to me directly. I can make sure that you're on our grad list, and then we can go from there. So if your loved one's turning 22, I agree with Miranda. It might be a little silly to send them to school for a couple of weeks. So we can connect over email, and I can make sure that you're taken care of when it comes to where you're at on the list. I'll get there. I don't want to mess up the screen, but I promise I'll leave my email on the screen. Okay, so services available. Service discussions should focus on what does the individual need rather than what services are available. So that's a little bit that we talked about before, especially with that consolidated waiver. The goal is not for an individual to have the most amount of services as possible. The goal is to find the services that best meet the individual's needs. Because if you look at the ISP manual, there is an abundance of services, but it's just finding what is going to properly support the individual. So teams have to identify what the individual needs, and determine how to do that. So you want to make sure that you also consider natural support, such as family members, community members, community resources, and any non-ODP supports as well. Because, we have individuals that are very involved in their community. So we want to make sure that they're not, that they're still, part of that, and, use those resources as best to their ability. And then also too, we always have to consider the least restrictive ways to meet an individual's needs first. So we want to make sure that we're giving individuals the most independence, the most autonomy, and making sure that the planning that is being done is person-centered, because at the end of the day, it's that individual's life and they're the ones who have to live it. So how can it be an everyday life for them, and what does that mean for them? I can do this one, Miranda, too,
Okay, go
because
ahead.
so again, services are based on need. So you want to make sure that you have those conversations with your supports coordinator and the team about, what the service is needed for. So an easy example would be employment. So let's say your loved one or your family member is is a candidate for employment. They've been enrolled with OVR. They've worked with, one of the employment, support agencies like the SIL, PIC or VIA, anything like that. At the end of the day, those services are going to fade. But let's say the individual still needs job coaching in order to remain successfully employed. We want to make sure that, the team has a conversation and they say, hey, this person's going to need job coaching so that they can remain employed, because that's what they want to do. And that's going to provide the least restrictive setting. Obviously, services have to be delivered by making sure that it meets the service definition. So that service definition is also going to be found in the ISP manual. So that kind of information is going to be something that the SC can find. I always reference the ISP manual on a day-to-day basis because there's so much in there. And then also your service authorization has to fit below the waiver cap. So if your loved one has a PFDS, you have to make sure that your services fit below that waiver cap of $41,000, but that it also supports an individual for an entire year. So if a person is receiving 10 hours a week of job coaching, you want to make sure that those 10 hours can be supported throughout an entire year. You don't want a person to have support only for 30 weeks out of the year, and then they don't have services for the rest of the year. Counties, I know, we typically wouldn't authorize a support like that, because you want to make sure that that support is that frequency and duration is ongoing and consistent, for the individual. And you can have a combination of services. They just all have to fit below the waiver cap. Oh, okay. So that
Yes.
got
So
questions, but
I'm
we'll
gonna
get to this.
I'm gonna stop the recording and then we can get to any specific questions that people might have.